Hi, I'm Dr. Dale Bransler. I'm the Chief COVID Officer for the University of Oklahoma, and I'm also a professor in both the College of Medicine and a professor and chair of the Department of Health Administration in the Hudson College of Public Health.
All right, and give us a little overview today.
So let me just, we've sent out some graphics to all of the reporters, and I'm just going to walk through those real quickly. So the first graphic simply shows the number of new cases in Oklahoma, and there's been a substantial peak in new cases in the past week. Today, I believe we had 228 newly confirmed cases in Oklahoma, and as you can see from the 7-day rolling average, we have reached a peak that's higher than at any other point in the pandemic here in the state. So our previous peak was in the first week of April, and now we're seeing levels of infection that are much, much higher. The other point I'll simply make is if you just look at what's happened in Oklahoma for the past 2 weeks, on average, we were seeing about 70 new cases confirmed in Oklahoma a day 2 weeks ago. As of today, we're seeing about 170 new cases on average daily that are being confirmed in the state. And so we often talk about bending the curve. So when we talk about bending the curve, you can see I've been plotting this pandemic outbreak now since it started. And I just put a simple straight trend line on the data, and nothing had moved beyond that first week of April. We just had a steady but slow progression in the new cases during that time. But over the past week or so, we've seen a substantial increase in the number of new cases, so we are bending the curve, sadly, in the wrong direction. The other thing that I've been trying to dispel is that the reason we have more positive cases now is because we're doing more tests. And we are certainly doing more tests now than we were doing in early April during this pandemic. However, during the week of May 17th, we peaked at the number of tests that we've been doing, just at 37,000 cases. And then in the next week, May 25th, we actually had the lowest number of the tests that were being done that were positive. Only 1.8% of the tests at that time frame were positive. However, that changed substantially last week. Last week we did just under 30,000 tests, and 4.6% of those tests were positive. And if you look at what was reported by the health department this Monday, yesterday, 6% of the tests that were run in the state were positive. If you look at it, again, this just simply shows that on the daily basis. When I look at it, the Thursday, Friday, and Monday of this past week, we saw this substantial increase in the number of tests that were positive that were being run in the state. So again, the point I'm trying to make is that the increase in number of cases is because there are more cases that are testing positive. It's not because we're doing more tests than we were just a few weeks ago. Finally, one of the metrics that we do follow that still remains pretty good is the total number of hospitalizations. So today, the data that came out yesterday, we've seen a little bit of a peak in hospitalization. There were about 170 people in the hospital that either were persons under investigation or confirmed cases. But on the last graphic that I sent out, it simply highlights that there were 98 patients with confirmed COVID-19 in hospitals, and sadly, usually hospitalizations will lag behind positive tests for a few days. So I'm expecting that it's likely that we'll see more hospitalizations over the next week.
So your point is that the patients may have it for a few days and it progresses and then they need to be hospitalized?
Yeah. For whatever reason, a patient maybe had some symptoms, went and got a test, the test comes back positive. If their symptoms progress, then they may end up in the hospital. Remember, a substantial number of the people who get this infection, 40 to 45%, based on the most recent data, are probably asymptomatic. They have the infection but don't even know it, or if they got tested, they're not having symptoms. So just the reality is, I think it's likely that we'll see a bump in hospitalizations and perhaps even more deaths. Deaths are delayed. They tend to occur 2 to 3 weeks after tests are confirmed.
So one thing that I noticed that the health department is telling people when you get tested there that it's 5 to 7 days before you even get your results. So how does that all play into everything?
Yeah, so it actually depends on which lab runs your test. So if we admit a patient to our hospital today with suspected COVID-19, a person under investigation, we have the results within the day. And so we rarely keep people in that person under investigation status very long. I know some of the reference laboratories that were out of state were having fairly long delays in getting the tests back. So there is likely some lag between when the test is actually done and when the results are getting reported.
Well, we have had a lot of questions today. Some of these might be a little bit redundant, but it doesn't hurt to continue to stress these points. Cassie McClurg with the Frontier was asking if Oklahoma, do we still meet White House criteria for reopening?
Yeah, so if you look at the White House criteria, they had what were called gating criteria. The gating criteria were simply those criteria you had to meet before you went into any next phase. And those criteria included 6 different criteria. And the ones that we still meet are we have plenty of hospital capacity, our hospitalization rates are low, and we have plenty of supplies in Oklahoma currently to take care of a lot of patients with COVID-19. Where we don't meet the criteria now are the fact that we have a rising number of new cases. So we went from 70 a day 2 weeks ago up to 170 a day based on the current daily averages, and the percentage of tests that are being done that are positive has gone up. It was low 1.8% the week of May 25th, but now this past week it was 4.6%, and in fact at the start of the week we only have 1 day's worth of data this week, but it was 6% of the tests are positive.
And so you've already kind of gone into this, but Cassie was also asking the state's trend in hospitalizations has yet to follow the trend of new cases. So just maybe again what some of the reasons for that.
Yeah, so I think that's a really important question. One thing we do know is that when you look at the people who are testing positive now, they're tending to be younger people. So they're people that are young, mobile, perhaps out in public, and are being infected. Those people tend to do better when they get the infection. As you know, the death rate goes up dramatically in patients 65 years of age or older, or those patients who have underlying chronic illness. So part of the reason we may not be seeing as many hospitalizations and deaths is that it's a different demographic that are right now testing positive. I think my one concern there is to remember that we have lots of Oklahomans with conditions like diabetes, chronic lung disease, who are immunosuppressed. And if those people that are infected have been out in the community perhaps before they even got tested, then we could see a peak in the number of frail, elderly, or chronically ill patients who get infected.
Okay. Emma Keith with the Norman Transcript was asking if you think this trend or expect this trend in cases will continue. If it does, is there a point at which the state should consider implementing more restrictions like we saw in April and May?
Yeah, I hope not. I mean, I, as much as anybody else, want to reopen the state. But I think there's a phrase I heard yesterday that I think is really relevant. Reopening doesn't equate with back to normal. We opened up restaurants. You can go out, do things. Businesses are open. But there was still the expectation, even in those reopening plans, that you physically distance and that you wear a mask. And I think that's where we've gotten lax in Oklahoma. If you go out into public, if you go out, it's very, very common to see groups of people with very few wearing masks. We've also had some events in Oklahoma, as you know, with the protest, Memorial Day weekend, and other events where a lot of people did get out. And potentially, if you're not wearing a mask, you put yourself at risk of getting the infection, but also potentially spreading the infection to someone else.
Phil Price at Fox 23 in Tulsa. I asked about that the state was averaging 44 deaths per 1,000 cases and now averaging fewer than 10 per 1,000 cases. And I know you've talked about just now about the ages being a contributor to that. Is there anything else why the deaths are trending down despite the rapid increase?
I think there's 2 different reasons. One, as we talked about, it's younger people that are being tested more commonly now, and they have lower rates of death when they get this infection. But the other thing is the hospitalization rate up until about a week ago had been steadily going down, and it's those patients that end up in the hospital on a ventilator that are more likely to die. So that number has been down, and that's one area where we do meet criteria, that we have still plenty of hospital capacity to take care of more patients. We certainly hope we're not going to fill up the hospitals with COVID-19 patients again.
So Steve Metzer at the Journal Record, as well as many other reporters, have asked about if gatherings of hundreds or thousands of people that are being planned, what are some precautions? I mean, if people do go to these things, what are the precautions they should be taking, and should we be concerned about that resulting in a serious spike in cases?
Yeah, so as I've talked about in multiple settings before, it is the density of people in a close space that translates into spread of the infection. So I don't care what event it is, if you bring a lot of people into a space that's relatively closed, there's an increased risk of transmission. So the number one intervention that you can do to help protect yourself and the people around you is to wear a mask. And so I would strongly encourage anybody going out into any public setting, whether it's a meeting or anything else, that they wear a mask. A study that was published last week in Lancet looked at a whole list of studies on wearing masks, and they showed that it was about 85% effective. It reduced the risk of infection by 85% from person-to-person spread. So I can't overemphasize both wearing a mask and doing your best that you can to physically distance from others.
So Angelica and some others at Fox 25 had a few questions that have been touched on already, but are there any other new trends in COVID cases that we're seeing that are worth mentioning, or pretty much the trends you discussed on your graphs?
Yeah, I haven't, I think everybody is aware that there's a big uptick in cases in Tulsa County. That's for a variety of reasons. I've talked with Dr. Bruce Dart, who has highlighted that they've had some open public events that have resulted in an uptick in number of cases in Tulsa County. So almost half the cases that occurred a few days ago came out of Tulsa County. They've had a very, very large spike in new cases, and I know the Tulsa City County Health Department and their team are really working hard to contain that infection. That's the biggest other issue that I've seen. We expect we're periodically going to see local community outbreaks. But what we're seeing now appears to be community spread again, where the virus is spreading from person to person in the community, and I think that's because we've gotten more lax when we're out in public about wearing masks and physically distancing.
Okay. I've had several questions just come in, so I need to sift through them, but in the meantime I had a couple reporters ask about Dexamethasone as gaining attention for treatment for critically ill COVID patients. So can you tell us a little bit about what that is?
Yeah, so that information was just published, a study out of the UK, a large study with almost 11,000 patients, where they randomized patients to either receive dexamethasone, which is a corticosteroid, a very common medication that we use in patients all the time, versus controlled group, which got usual care. And the most important finding from the study was when those patients were sick enough to be on a ventilator, on the breathing machine, those patients that got dexamethasone had about a 30% reduction in their risk of death compared to those who did not get dexamethasone. So it's a good study because it's large, it's randomized, they had a control group that got usual care, and again, particularly in the most critically ill patients, there was about a 30 to 33% reduction in overall death rate.
That sounds promising. Are there other promising new drug developments, or?
Yeah, so of course one drug that we've tested has been remdesivir, which is one of the antiviral drugs, which has been shown to shorten hospital stays. It hasn't had too much effect yet on overall mortality, but it does, for those patients who are hospitalized, can shorten hospitalization. And then I think I've talked about on several occasions before a couple of things we've learned. Patients with particularly severe COVID-19 are very susceptible to blood clots, and so there was a large study that came out of New York that showed that if those patients with severe COVID were on anticoagulants, blood thinners, it dramatically reduced their mortality. And then, as I think you and I talked about once before, there was a study that looked at the over-the-counter dyspepsia drug, Pepsid or famotidine, which showed that it potentially could reduce mortality also. So we're still learning a lot about the treatment. So far, the trials of convalescent plasma have been haven't shown marked improvements yet, but they're very small. We just don't have enough patients in those studies yet.
One thing it seems like what is important to stress is that even though it seems like this has been going on for an eternity, we are still in a very new stage with this disease in general, right?
We're just barely over 3 months into this pandemic in Oklahoma. Our first case was diagnosed on March 6th. It is now June 16th, so we're 10 days into our 4th month of this particular pandemic. It's been remarkable, the impact that this pandemic has had on multiple things, both healthcare, the healthcare system, people, their lives, and the economy.
Okay. Sorry. All right, so Brent at K4 is asking, why is the state saying it's because of more testing, the increase, when the numbers say otherwise?
Of course, I can't speak for the state. We're definitely, as I pointed out, we're definitely doing more tests now than we were in early April, no doubt about it. But we hit our peak of testing the week of May 17th when we did just under 37,000 tests in the state. We did about 30,000 last week, so still a whole lot of tests. But the big change for me, and something that I track each day, is what percentage of the tests that have been done were actually positive. I know even within our own hospital laboratory, we had one day last week where they tested more than 450 samples, and 20% of them were positive, which is just unprecedented. So I think a lot of hospitals around the state have been reporting that they're seeing more people test positive than they had in the past.
Okay, Jackie at Fox 23 in Tulsa, what should a normal family be doing right now? Which summer activities are low versus high risk? Lakes, bars, 5Ks, etc.
That's a great question. So just a couple general things. One, we know that the risk of transmission of the virus from person to person is much greater indoors than it is outdoors. That's been shown before in a variety of studies. So outdoor activities tend to be safer. But remember, even in outdoor activities, transmission of the virus has been confirmed, particularly if you're in an outdoor activity with a lot of people in a crowded setting. So again, remembering physical distancing even when you're outside. So I think things like going to the lake, going out to a park, going camping, things like that are very, very safe, and you should do that. I encourage people to get out of the house and do those types of things, going on walks and things like that. Just remember to think about your surrounding and how many people are around you. Indoor activities, anywhere where there's a large group of people, particularly if they're not wearing masks, have increased risk of person-to-person transmission.
She also asks, we've seen some businesses spreading COVID-19 among employees. What is an employer's responsibility? Can you speak to that?
Well, I'm not an attorney at all, and I think, I will tell you what we've seen on the Health Sciences Center, because we've had a few employees that have tested positive. What we're seeing is we have very strict policies here across our entire campus. You cannot come into our buildings without wearing a mask. You cannot go into meetings. We do everything via webinar or video conference. We don't congregate people at all. All of our healthcare workers, nurses, doctors, and others that are taking care of patients are wearing N95 masks and personal protective equipment. The cases that we're seeing are people that get it outside of our system and then come into the system. And I think that's what's happening in Tulsa. I know there's a company that's got a big group of employees being tested right now, but it's my understanding that the outbreak did not start inside of that company, that the outbreak started in an event that happened outside of the company, and those infected people happened to work at that particular company. So I think it's remembering, we can wear a mask all day long here at the Health Sciences Center, at work, personal protective equipment and other things, but if we go out at night and we go into a crowded bar, or if we go to some setting where there are a lot of people and they're not wearing masks, then we're going to increase the risk of person-to-person transmission.
Okay, I don't have any other questions because you answered everybody's questions in one way or the other, but tell us, what is the one thing that we can do to help stay safe and keep our loved ones safe.
Yeah,
And-
so I'm going to say it again. Reopening did not mean return to normal. Reopening means that we can go out and participate in business activities and other things, but we still have to wear a mask. We still need to practice physical distancing because those are the interventions that are the best of preventing person-to-person transmission of this virus. So that's the most important thing.